Hello, I'm Michał. I'm a veterinarian, and today I would like to tell you about the problem of ovarian acyclicity. Of course, there is a lot to say about ovarian acyclicity, but I would like to focus more on a practical approach, meaning what interests us in a herd, when it occurs, what to pay attention to, and how to treat it in the field. Ovarian acyclicity can be divided into ovarian inactivity, ovarian cysts, and the occurrence of persistent corpora lutea. I will tell you a few words about each of these cases. Let's start with ovarian inactivity. What is ovarian inactivity? As the name suggests, inactivity means there is no function. The ovary is not performing its function, or the structures on the ovary are not performing the function they should. This means that most commonly there is a lack of follicles, or if these follicles are present, they are very small, up to 9 mm based on my observations, and of course there are no corpora lutea on the ovary. This is our criterion for diagnosing ovarian inactivity, when we do not see any corpora lutea on the ovary during the cycle. Why does ovarian inactivity occur? There are several reasons. The main cause of ovarian inactivity is a lack of energy. Therefore, if ovarian inactivity occurs in the herd, we must place great emphasis on nutrition. And not just the nutrition during lactation, but also the nutrition during the dry period. Let's say a few words about that. When it comes to nutrition in the dry period, it is usually divided into two parts. The second part, which is the 3 weeks before calving, is crucial. And we must pay very close attention to what this nutrition looks like, what the energy supply is, and the status of micro and macro elements. The best way to see if there are any nutritional errors occurring during the dry period is to test for subclinical ketosis. That is, we test the blood of all cows that have calved over a certain period of time for ketone body levels. We test this between the 5th and 7th day and calculate the average. If it turns out that the cows have a problem with subclinical ketosis, we must adjust the nutritional ration. The second most common cause of ovarian inactivity is, however, a lack of micro and macro elements. We need to focus on various microelements, but the key ones are copper, iodine, zinc, phosphorus, selenium, and vitamins A, D3, E, which are fat-soluble vitamins. We must have this secured. And what happens when there is not enough of these vitamins? Ovarian inactivity often occurs, and it is frequently the type of ovarian inactivity that appears on day 60, 70, or 80 after calving, and not right at the beginning. Of course, ovarian inactivity can be a complication after many diseases. It can be a complication after ketosis, it can be a complication after postpartum hypercalcemia, milk fever, or it can be a complication after difficult calving. In those animals, we observe that ovarian inactivity occurs more frequently. How do we treat ovarian inactivity? It depends on the cause of its occurrence. The first thing we must pay attention to is correcting the nutritional ration regarding both energy and micro and macro elements. What can we do to help the cow quickly? Here, time plays a key role. Once we supplement what the cow is missing, the oocyte needs time to develop. We know that an oocyte takes about 70 days to form on average, so it's not the case that after treating ovarian inactivity, cows become pregnant very quickly. What can we do? Treatment is most often very varied, and depending on the herd, we can treat hormonally. We have several hormones at our disposal, which we administer depending on the hormone regimen. In the case of ovarian inactivity, it is often common to administer hormones at higher concentrations or in higher quantities than usual. They are often combined in the therapy. These are also often cyclic therapies, meaning, for example, we administer hormones for 5 or 7 days, every day at the same time, in order to stimulate the brain to secrete hormones and to restore hormonal balance so that the ovaries start working. If we know that the problem is also a mineral and vitamin deficiency, it is always worth supplementing vitamins by injection, or via boluses, or both. Remember that ovarian inactivity is a really big problem, and if it occurs in the herd, you must always be in contact with a nutritionist. Here, the cooperation between the breeder, the veterinarian, and the nutritionist is crucial.